Femi Oguntoye. We're staying with developments on the outbreak of cholera in Lagos State as government says death from the cases recorded rises from 15 to 21, while infections also increased to 401 from 350 cases. Special advisor to the Lagos State Governor on Health, Dr. Kemi Ogunyemi, said the rise in cases was anticipated following the Eid al-Kabir celebration in which large gatherings occurred. Mrs. Ogunyemi disclosed this in an update released by the Director of Public Affairs in the state's Ministry of Health. She said the cases increased to 401 across Lagos, with Lagos Island, Kosofe, and Etiosa recording the highest number of infections. She noted that suspected cases are subsiding across local government areas, particularly in previously affected LGAs due to state government's intervention and surveillance efforts. I'm joined on the news now by consultant public health physician and senior special assistant to the governor on health, Dr. Oluwatoni Adeyemi. Dr. Adeyemi, thank you for joining us on the news at 7.
Thank you very much for having me.
The number of deaths from cholera outbreak in Lagos has increased to 21 with 401 suspected cases. We should all be concerned, right?
Well, yes and no, because actually these deaths are cholera-related deaths. So what that means is basically they are from suspected cases of cholera. Unfortunately, because most of them presented quite late, some of them were actually brought in dead. So it was a bit difficult to actually test and do any confirmatory test for cholera. In an outbreak situation, when anybody, any death fits the case definition, it's counted as a cholera-related death. So they are actually cholera-related deaths, and they are not directly linked to cholera because there were no confirmatory tests done.
So is it clear what the source of the infection has been over the weeks?
Okay, so the good thing is immediately this outbreak started, a public health emergency operating center was constituted, and it comprised of various ministries across sectors. So we have the Ministry of Environment and LASEPA, that's the Lagos State Environmental Protection Agency. So they've been on the field since that started, and even our Directorate of Environment at the Ministry of Health testing water samples. Lagos Island was one of the hot areas. We had the highest number of cases around 10th to 13th of June. So they've actually been on the field since then, testing these water samples. The results have started out. We've received the first batch of results yesterday, and I'm sure that very soon the communication would actually be made known to the public on what was found in this result. But definitely there has been some contamination in some water bodies that have actually been sampled. Sampling is still going on. We're still testing water samples. We're still testing some beverages as well. That some of the confirmed cases of cholera from the history was found that it took some particular beverages. So we're still testing that to actually confirm and localize the source of infection. So it's ongoing, but we have made significant progress in that regards.
With the onset of this outbreak, we're hearing that cholera treatment is provided free of charge at all public health facilities. What symptoms should Lagosians look out for, and what should they do next?
Okay, so basically the case definition for cholera, we have could either be a suspected case or a confirmed case. A suspected case is any person over the age of 5 who presents with severe diarrhea or acute diarrhea with or without vomiting and with or without fever. So right now, but in this outbreak situation now, anybody at all, because we have an outbreak, anybody at all above the age of 5 that presents with diarrhea, whether or not there is vomiting, should see their healthcare provider. It doesn't necessarily mean it's cholera, but because we're doing an active case search, we are actively looking for cases so that we don't miss out any. So it's recommended that once you have these symptoms, these are the basic symptoms, acute watery diarrhea, plus or minus vomiting, please go to your nearest healthcare provider. You can go to any of our government facilities at the primary, secondary, or tertiary level so that you can get tested and we know if it's cholera and we can contain that outbreak from your locality, from where you're from, your geographical location, so that it can be well contained, and there can also be tracing or contact tracing afterwards. So that's the current recommendation now.
Precisely what do you say to people who usually will eat out, in the midst of this outbreak? What are they supposed to look out for? What kind of caution must they take?
So basically, for caution as regards cholera, we can divide it into like the 5 Fs, because cholera is transmitted through the fecal-oral route. So it's transmitted, that's feces coming in contact with the human body by ingestion through any of these Fs that I'm going to mention. So the first thing is through food, so contaminated food, contaminated fluids, even our fingers, and then also it can even from flies. So the recommendation for precautionary measures for people, especially those that eat out, since you already have an idea of how this can be transmitted, it's recommended that first of all, you wash your hands carefully. We remember COVID, remember the hand hygiene measures we employed then. It's now time to bring it back, especially before eating, after using the toilet. And if you're going to buy anything outside at this point in time, ensure you wash it properly. Ensure that you don't eat raw foods as much as possible, because boiling can also decontaminate your food. So boiling, you boil your water. If you have access to chlorination, you can chlorinate your water, or just buy table water. Even though we know that it's not all table waters that are actually good source of drinking water, but there are ways to find out. For example, if you buy table water, to be sure that it hasn't been adulterated, or it hasn't been there has been no foul play with it. You can just squeeze it, and if nothing spills out, you know that, okay, your water is safe, provided it has a NAFDAC number. So these are some of the measures that people need to employ at this point in time. Importantly, hand hygiene, your food hygiene. Don't leave your food open, because as I said, flies also can actually, a fly that has perched on feces can actually perch on your food. No indiscriminate open defecation. So your environment has to be very clean as well, because fields is the last F. If you have feces in some of those fields, flies can pester on them, and by the time they find a source, that's food now, they can perch on them. So environmental hygiene, hand hygiene, your food hygiene.
Absolutely. Dr. Oluwatoyin Adeyemi is a consultant public health physician and senior special assistant to the Lagos State Governor on Health. Thank you so much for talking to us.
Thank you very much for having me.
And to commemorate this year's World Sickle Cell Day, policymakers